Hello, so today we're going to be talking about arson within our chemical research today. So what is arson? Arson is an inorganic compound known as ASH3-. It is a flammable, pyrophoric, and highly toxic gas. Pyrophoric means that the substance is capable of igniting spontaneously when exposed to air. But the gas itself tends to smell slightly of garlic, but it's mainly an odorless gas. But some people, like I said, tend to report a slight garlic smell. And it is made by the reaction of some arsenides with acids. So what is its use? Even though this is a lethal gas, some applications in the semiconductor industry use it and for the synthesis of organoarsenic compounds. It can be used for the refining industries. So exposure to this gas is highly toxic and likely unknown because, as I mentioned, of the odorless property to the gas. With routes of exposure, this chemical is mostly inhaled, as you could probably guess, because it is a gas. Breathing in the gas is the most likely route, and the arson vapor is heavier than air, so we would most likely find this in low-lying areas due to the heaviness. We also can see ingestion. It's unlikely, like I said, because it is a gas, at room temperature. But you never know, things do happen. And then with metal arsenides, they are solids that can be ingested. I know we're talking about, our gas form here, but with the solid form, if it's ingested, the stomach acids will end up releasing arson gas anyway. So, like I said, highly toxic chemical. As mentioned, arson is usually inhaled into the body, so it's absorbed through the lungs. It has not been known to be absorbed into the body through the eyes or the skin, but it can stick to these areas, which we'll kind of talk about later. Arson will begin to affect the body within 2 to 24 hours after exposure. Gas enters the blood, which is then distributed into the lungs, kidneys, liver, and other organs. Again, we will talk about that later. And it's excreted primarily through the kidneys, which we will see in some of the signs and symptoms. So within our hazard assessment, there's different toxic effects with different levels of exposure or doses, essentially, of this chemical. So at low doses, we can see confusion, drowsiness, fatigue, headache, shortness of breath, jaundice, red and dark urine. Some of these symptoms, like I said, the red and dark urine, we know it's affecting the kidneys. Jaundice, we know it's affecting the liver. At high doses, we can see convulsions, level of consciousness change, paralysis, and respiratory depression. Long-term health effects from this chemical is kidney damage, numbness and pain in the extremities, and neuropsychological signs and symptoms such as memory loss, confusion, and irritability. If you're able to survive the exposure to this, treatments include IV fluids, probably something like normal saline, dialysis, and blood transfusions. Replacement chemical that was found is stibine. This is a similar gas to arson. It is formed when the metal antimony comes in contact with an acid. This chemical also has health effects similar to those of arson, but it is not widely available at all. The gas does have more of a rotten egg odor than the odorless arson. Standard levels for safe use with this chemical include protective clothing, a self-contained breathing apparatus, and chemical-resistant suit and gloves. If you are exposed to the chemical, first you need to get fresh air by leaving the area. If you're able to get fresh air, this greatly reduces the possibility of death. When you remove your clothing, you want to rapidly wash your entire body with soap and water and seek medical care as soon as possible. If you are exposed, then you want to remove your clothing. Arson does stick to the fabric, and for clothing that should be pulled over your head, like a t-shirt or anything like that, you need to cut it off instead of lifting it over your head because you want to keep it away from your airway. Second, wash yourself. Wash yourself with large amounts of soap and water as quickly as you can. And if your eyes are burning or your vision is blurred, rinse your eyes with water for about 10 to 15 minutes. If you have contacts in, you need to remove them and do not put them back in your eyes. If you have glasses, make sure to wash them with soap and water. When you dispose of your clothing, you need to wear gloves while putting the clothes into a plastic bag. All the items that may have been exposed to arson need to be put in the bag as well, such as those contacts or other loose items. The local or state health department or emergency personnel will then arrive to take the bag and dispose of it properly.
And this was my references.